Pituitary apoplexy. It's very important in AMC exam. The idea of it is impairment of blood supply of the pituitary gland due to enlargement of its size with pregnancy without an increase in its blood supply. That will lead to infraction or hemorrhage of the pituitary gland. So, with the pregnancy, the pituitary gland increased in size, but the blood supply remained the same. That will lead to a risk of infraction due to decrease in blood supply or hemorrhage. Okay, so the keyword of it will be sudden severe headache in pregnant woman. Sudden severe headache in a pregnant woman. In AMC exam, we have to differentiate diagnosis, which is first preeclampsia, and the second one is pituitary apoplexy. In case of preeclampsia, you should have other symptoms and signs of preeclampsia like proteinuria, hypertension, and others. But in case of pituitary apoplexy, it's an infraction of the pituitary gland, which is sudden severe headache, okay, in a pregnant woman with hormonal problems due to pituitary infraction, okay? But there is no hypertension, no proteinuria, no these symptoms related to preeclampsia. For investigation, the investigation of choice in case of pituitary apoplexy in AMC exam is MRI. And you will see a picture like this. Here, this represents hemorrhage inside the pituitary gland, which is pituitary apoplexy. That's all related to pituitary apoplexy. Prolactinoma. It's important. It's a tumor of pituitary gland that causes increase in secretion of prolactin hormone. So the keyword will be increase in prolactin hormone. For clinical pictures, well, in female, increased prolactin hormone will lead to amenorrhea and galactorrhea. Amenorrhea, which means stopping of menses, and galactorrhea mean increase the secretion, white secretion from the nipple of the woman. But in case of male, it will lead to erectile dysfunction and gynecomastia, which mean increase in size of the breast in male. For investigation, the first step is always prolactin hormone. Always start by laboratory test. I mean prolactin hormone. And you will see it's more than 1000. And the second step is MRI, which is the investigation of choice. But please start with prolactin hormone first. For the treatment, always start with medical treatment, whatever the size of the tumor. I mean, start with bromocriptine or gabapentin. So please remember, start with medical treatment always, whatever the size of the tumor. And after stabilizing the patient and decreasing the size of the tumor with medication, then surgery, which is the treatment of choice. And it will done by approach called transsphenoidal approach. Okay, it's clear, but it's important. That's all. For full course, please contact us through imcqbook@gmail.com. Thanks and goodbye.